8:14 now. Welcome back. Well, bringing a new baby into the world is stressful enough, but new moms have a lot more on their plate right now, navigating pregnancy and the coronavirus pandemic. Dr. Whitney Caceres is a Portland pediatrician, a mom of two young girls, and creator of modernmommydoc.com. And she joins us via Skype this morning with some advice for new parents who've got to be going through a lot right now. Good morning, Whitney.
Good morning.
So I know we've talked so much about COVID-19 and older adults. What do we know so far? What's the latest research on coronavirus and symptoms in babies and young children?
So, of course, this is a situation that's constantly evolving. We're getting new information day by day. So far, it does not appear that new babies and children are at higher risk for COVID-19 than other populations, though we continue to learn more as we go along as to how this is impacting them.
Yeah, so I know for couples who are getting ready to have a baby, for pregnant women out there, this has to be a tough time. You're getting ready to go in and out of the hospital quite a bit, and that's a tough place to be right now. So are there any kind of precautions that expectant moms and dads need to be taking as they get ready for delivery?
Well, the good news is hospitals are stepping up their game just like the rest of us in the healthcare sector. So they are limiting the number of visitors that can come to the hospital, screening those visitors, and then making sure, of course, that their employees are not sick before they come to take care of a baby at the hospital. And then, thankfully, just because babies are at higher risk and a more vulnerable population for other bacterial infections and viruses, usually hospital or maternity wards in hospitals are kept separate from other areas of the hospital where patients might be more sick.
Yeah, no, I know visitors to hospitals is kind of an issue right now. So, any advice for parents in terms of limiting visitors, both at the hospital and then also when you get your baby home?
Yeah, this is a time where keeping more isolated is really a good idea, especially because older adults we know are at higher risk for COVID-19. And so those grandparents who would normally maybe be flying to come see you or just traveling to see you and coming into a hospital setting, it's a good idea to keep them not there at this point. And then in terms of at home, if you have other young children at home, we also want to keep grandparents and older individuals away from kids who might be sick right now, just to keep them as safe as possible.
Yeah, I know that's a tough call for parents to make, but safety first, absolutely. Now, Whitney, one thing that I know you've talked about before, and I know you talked about it a little bit here in your new book too, is setting women up for success. I know new moms already face so much social isolation, postpartum depression and anxiety can be an issue for so many women, and that has to be even harder right now.
Oh, absolutely. So I wrote this book because when I had a new baby, even though I was a Stanford trained pediatrician, knew everything by the book, I still struggled. Motherhood hit me like a ton of bricks with my colicky, really difficult baby who never ever slept, who I love at this point, but was difficult in the beginning. And so it's really hard for families, no matter what, just at baseline. We know that 1 in 7 women experience postpartum depression or anxiety. And we know that when you add social isolation to the mix, that increases their risk of having more anxiety and depression. So this is a moment where parents have to be proactive about taking care of their mental health and reach out to resources. Thankfully, in Portland, we have some amazing resources. Postpartum Support International, Baby Blues Connection, and then, of course, your own pediatrician or OBGYN are amazing resources for you.
Yeah, I think that's a good thing to keep in mind. Also, for women who maybe are having trouble with lactation and breastfeeding, when you don't want to be going back and forth to health clinics right now, are more doctors trying to offer some telehealth and other things besides just in office?
Oh, for sure. So for some visits, it does need to be in office. And for example, in my clinic, we are still welcoming new babies to come see us for in-person support when it's necessary, because we know that there are other health issues like extreme weight loss and jaundice that we have to make sure we're taking care of, even in light of the COVID-19 pandemic. But absolutely ask your provider about telehealth opportunities with the hospitals as well, so that you can try to limit your exposure to other people who are sick at this time.
All right, all good advice, Whitney. We appreciate it. And I know you mentioned you pulled from a lot of your own experiences here in your new book. I was looking through it, and there is some great advice here for couples and new moms and parents just leading up to and after birth, and going to be a good resource, especially with everything going on right now. Whitney, thank you. The new Baby Blueprint available now. You can find more at KOIN.com.